1027, 1035, WICY, your feel-good tunes of the 80s and more. I'm John Kazar, but it's not about music right now. It's about conversation we're having with Dr. Todd Whitman from the Alice Hyde Medical Center. And there's also another facility you work for, right, Todd?
Yes, I work for CVPH Medical Center as well.
That's double duty, or are they connected for you, or what's going on with that?
They are. It's great. The two institutions really work well together, and I think we bring each other up.
Yeah. Well, what's your opinion right now on the state of things as far as your line of work and how you've been dealing with the impacts of COVID-19?
So, I think we're all so grateful that we didn't meet the surge that we were anticipating, and now we're trying to figure out how we reopen facilities in a safe way and provide people with all the health care that they've been lacking access to in the last couple of months.
Sure. Antibody testing is a big topic these days. Tell us more on that.
It is. Antibody testing is tricky. It's a great test to look at a community and try and get a sense of, how many people have had this infection. It's not so useful when it comes to a particular individual, though, and the Department of Health and others have put statements out on this. I think a lot of people had hopes that, we'd be able to get an antibody test and we could know if we were immune to this infection. And right now, we don't have the capacity to do that. Right now, the antibody test is not a good enough test to be able to tell you as an individual if you are safe from this infection. And so, we just want to make sure that people understand the test, make sure that if you are interested in having that testing, you discuss it at length with your primary care provider, because we don't want to end up in a position where people think that they're immune and they go out and spread this around because the test wasn't the test that they thought it was.
Right, and that's the key. Let's talk about an update on reemergence of all this, potentially.
Yeah, exactly. So the governor has given us permission to start opening our facilities back up, specifically surgical procedures, which we're starting the process of slowly reopening that. Again, we want to make sure we do everything just as safe as we possibly can. And I think that we're clearly moving in the right direction. Lots of policies. We've been working on that all morning this morning.
Beautiful.
So we want to get people back into the facilities and keep them safe.
I mean, there's certain things we can start to get back in the swing of things of. Others, if we're talking about social, out, events and stuff like that, gatherings, even dine in restaurants. I think we'll slow down on that for a little bit. What's your opinion? I know this is a little outside of what you wanted to talk about, but I just in general think we got to take the safe route.
Absolutely. I agree with you. We're so lucky that the population in Malone has been so willing to socially isolate and really keep their distance from each other and not spread this virus around. And as the communities do start to open up, as the weather warms up, there's going to be, I think, a lot of desire to get out and do things. And we just need to really maintain that social distancing, minimize non-essential travel, make sure that we're using proper hand hygiene and continue to use those cloth masks.
Because there are going to be people that are infected walking around. That's the bottom line. How many? We want it to be as limited as possible, but there's going to be those people. But if those people are taking the precautions themselves along with other people around them, it's not going to be passed, even if they are around,
Right.
You can't
Exactly.
be too close, obviously not within 6 feet of someone and breathing on them, but you know what I mean? We can coexist. We can coexist.
And I think we're all going to learn how to do this as we move forward. I think it's always important to remember that, when you're social distancing and wearing your mask, you're not only protecting yourself, but you're protecting everybody else around you.
Sure. Todd, we covered right there kind of how to stay safe during, this reopening. Anything else you want to add to that, or do you think we're good?
No, I think we're good.
I do, too. We talk every week. We get an update from you, and I'm looking forward to next week as we move closer and closer to the light at the end of the tunnel, Todd. We appreciate it.
I appreciate it as well. You have a great rest of the day.
I will. You too, rest of the week. It's 1027, 1035 WICY, diving inside the community with Dr. Todd Whitman.